We are in the midst of flu season in Toronto, and public health says your chances of getting sick have just gone up.
As we get into the end of December, the beginning of January, the number of influenza cases tends to increase. A healthy person who gets the flu might get a headache, feel unwell, total body aches, a high fever, be in bed for a few days, but might not need to go to a doctor, might be able to take medicines and rest at home. Children can also get some vomiting or diarrhea associated with it.
From December 8th to 14th, there were 58 confirmed cases of influenza. From December 15th to the 21st, 116 cases. To date this season, 275 cases have been reported, higher than the previous 5-season mean of 266 cases. Toronto Public Health's Associate Medical Officer of Health says right now both influenza A and B strains are spreading at the same time.
Typically an influenza A strain, especially the AH3N2 strain, can actually be more serious, especially for the elderly. And we're actually seeing that. That strain is spreading, and we're seeing more of that strain impacting the elderly. More of them are getting hospitalized from that strain. There's also an influenza A H1N1 strain that can circulate, and that's spreading as well, tends not to make you as sick. The influenza B strain, there are two types of influenza B strains that can circulate, and the one that's circulating in general tends to make children more sick.
Dr. Dubé says generally only lab-confirmed cases are documented, like instances where people end up hospitalized. So in order to avoid the worst-case scenario, she suggests to get the flu shot, but also to cover your cough, wash your hands often, don't touch your face or mouth, and stay home if you're sick.
Just from past experience, when I get the flu shot, I don't feel well, and it makes me feel funny for like 2 days.
Other viruses are also spreading that give you flu-like symptoms. And so sometimes people get the flu shot and they say, I got sick from the flu shot, but actually there's other viruses that are also spreading.
Dr. Dubé says if you have asthma or heart disease, getting the flu can actually make those conditions worse. So it's a good idea to get the flu shot. Maleeha Sheikh, City News, Toronto.